who's going to give us a little bit of a background about anatomy, pathophysiology of hearing loss. So first of all, a lot of people suffer from hearing loss, and this is not just an age-related thing. This is all people, all Americans in the statistics. So more than 31 million Americans do have hearing loss, okay? So yes, it's more common as we age, but it can affect people at all ages. So just remember that there are people out there with hearing aids at age 2, all the way up to 102. So 15% of baby boomers though do have hearing loss, okay? And 30% of people over the age of 65 do have hearing loss. It is one of the most common health problems in America today, right up there with high blood pressure and arthritis. So it's very, very common.
There's 3 main components to the ear, and this is how I kind of describe to patients when they come into the office. There's the outer ear, you'll see, which is made up of the helix, the auricle, what you see as an ear, and then the ear canal. Then we have what's called the middle ear, which is the space behind the eardrum, which when we're looking in the ear, we'll look at the surface of the eardrum, and the space behind the eardrum toward the inner ear is called the middle ear space. And that's what houses the little bones of hearing that people call the malleus, incus, and stapes. The hammer, the anvil, and stirrup is what kind of laypersons will call it. And that's where kids get ear infections, you get fluid in the middle ear, and that type of thing. Inner ear is then what houses the nerve center of hearing. We call it the cochlea, and that's the sense organ of hearing, and that's connected then to the hearing nerve we call the auditory nerve, which then runs to the brain. And so when people have sensorineural hearing loss or neurologic hearing loss, which is the majority of hearing loss, it'll be something affecting that region, the inner ear.
So the types of hearing loss, there are basically 3 different types of hearing loss. There's conductive hearing loss, sensorineural hearing loss, or nerve-related hearing loss, and then mixed hearing loss is kind of a combination of those 2. Now these can be from noise exposure, they can be from drugs that can cause hearing loss, they can be from a condition called Meniere's disease, which also affects the balance part of the inner ear. Acoustic neuroma is a benign tumor of the inner ear nerve. And the most common one on this list is actually at the bottom, presbycusis. And presbycusis is age-related hearing loss. So that's by and large the most common cause of sensorineural hearing loss is the presbycusis.
Tinnitus or tinnitus, it's described or pronounced, that's the generation of sound in your ear. And it just, you'll say, yeah, I hear something, and everybody around you is saying, I don't hear it, but you're hearing it. It's a generation of sound inside your head, inside your ear. A lot of things can cause tinnitus. The most common source of tinnitus is those outer hair cells we talked about. When you start to develop damage to those hair cells, not only do you have trouble hearing because it takes a stronger sound impulse to get to those hair cells, to bend them to create the sound, but the fact that they're always bent and always sort of damaged means they're always sort of firing. So they're always releasing this little sound, this little impulse, and so you just hear something, even though there's nothing making a noise around you, you'll hear this noise in your head.
So these are different forms of tinnitus. Again, Dr. Fleming mentioned a lot of this. Ringing, buzzing, hissing, roaring, whistling. Crickets is an interesting one. I have a lot of people that hear crickets, and that would probably drive me crazy. I do have one patient that hears the same song over and over again, and that would probably really drive me crazy. But the cool thing, if she really concentrates, she can change it to one other song, and then she hears that song over and over again.
Number 1 would be to have an audiological evaluation. Also to have an evaluation by ear, nose, and throat physician. You want to look, test that organ of hearing to see what it's doing. Is it coming from within the organ of hearing? If, hearing loss is found, there's treatment there, or if there's something else going on, potentially, like a Meniere's disease or something, there are some specific treatment options medically there. Limiting the control or controlling or limiting stress. You kind of touched on that with your question earlier when you said if you have the tinnitus, then you take a little bit of a break, you kind of relax for a little bit, and your tinnitus goes away. Stress is definitely something that just wears on your body. And so eliminating your stress, I have a couple patients who actually do yoga to help or meditate to kind of help reduce the stress. That can also take away from the tinnitus in their ears. Also treating anxiety and depression. Again, but some of those medications can have some side effects and have some addictive properties.
So we want you to know that help is available now. And this is where we're going to get into the different options for treatment. So the first one that we're going to talk about is tinnitus masking. And masking basically just means that we're trying to cover it up. So we're going to give you a sound in your ear that you find to be more pleasing than the ringing. And that's going to give you a little bit of a break from the ringing that you're hearing in your head. Then habituation is to convince the brain to not listen to the ringing. So we're actually going to play a sound in your ears that your brain can hear that it likes better. And we're going to say, yoo-hoo, listen over here, don't listen to that. And it does work very well for a lot of people.